Hello, my name is Matthew Frankick with Freedom Insurance Advisors. Thanks for coming on back. This is our Medicare 101 educational video series, and on this video we'll be discussing Original Medicare, and that's comprised of Medicare Part A and Part B. Medicare Part A is your hospitalization coverage. Now it's a little bit more than that, but just remember Part A is hospitals. It'll include your inpatient hospitalization, skilled nursing facilities, along with your home health care. Now with that, you're going to have a deductible for when you go into the hospital as an inpatient, and that's going to be $1,288. That's for 2016. It changes from year to year typically, but for the first 90 days, if you're in the hospital, check that, the first 60 days that is, you'll have that amount to pay. It's a deductible. That means you pay that, the insurance pays the rest. After which, you begin to pay a copay for your days in the hospital for days 61 through 90, and then it gets a little bit higher for days 91 and beyond. That's your hospitalization. For your skilled nursing, now your first 20 days in skilled nursing is covered fully by Medicare. After which, up to day 100, you're going to share costs. If you just have Medicare Part A, it's $161 a day. But after 100 days, you pay the full costs. So that's your Medicare Part A and Part B. Also, your hospice is included in there, which is covered 100% by Medicare. Next, let's continue Medicare Part B, and that's going to be your doctors or your medical insurance. And anything from your outpatient care, your primary care doctor, specialists, your preventive care, also things such as durable medical equipment, other drugs that are administered by a doctor. Those could be included in your Part B. Now, Medicare Part B has a deductible as well. It's a one-time per year deductible. In 2016, that's $163. Once you've satisfied that dollar amount, at that point, did I say 166? I should have said 166. I think I said 163, but 166 for 2016. Once you've paid that, then it's co-insurance there on out. Co-insurance means you share the insurance with the insurance company, in this case the federal government or Medicare, and your cost sharing is 20%. Medicare pays 80% of what they're paying for. So again, that comprises Original Medicare. You have Part A, your hospitals, and Part B, your medical or your doctors. Now, one key thing to remember is Original Medicare doesn't cover everything. Okay, one thing with health insurance, you have a out-of-pocket spending limit, and we don't see that with Part A and Part B. There's no stopping point to the costs that you may incur, so that's why you typically add something on to that. In addition, there's no talk of dental coverage or vision, hearing, stuff like that, additional coverages that are not set by Medicare that Medicare is not going to cover. So again, Medicare alone, Medicare A and B, or Original Medicare, does not cover everything. So that's an overview of Original Medicare. Again, thanks for coming back. My name is Matthew Frankick, Freedom Insurance Advisors. We're glad you're here, having some fun with us. You can see my straw hat this day. That must mean the sun is shining high outside. Nonetheless, until next time, I look forward to helping you soon.